Good morning, everyone. Welcome back. I hope everyone enjoyed a nice holiday break last week. We are down to our last 3 weeks of our Cardio-ECHO clinic, Your Patient with Diabetes at Risk for Heart Disease, a series of case discussions. I'll put up the usual contact info, and I'll say this reminder again at the end, but feel free to reach out to me for those of you in this fall series, if you're interested in presenting an additional case study. We do have a little bit of wiggle room over the next couple of weeks, so feel free to email me. As always, please go ahead and chat your name and your practice name into the chat feature just to record attendance. And I'll go ahead and let Dr. Rao take it from here.
Thank you, Jesse, and thanks to everyone for joining us again this morning. So we have two really interesting cases and a great presentation as well. So our lead discussants this morning will include Kathleen and Mary Lee. I think was originally our lead discussant, but she'll actually be a case presenter this morning as well. She has a really fascinating case. But first, we're going to hear about type 2 diabetes in rural contexts, and that's really important here in Ohio, which has one of the largest rural populations in the United States. So Liz, please take it away.
Thank you, Dr. Rao. Thank you. That slide that just passes, just a reminder to be mindful about the language that we use while we're discussing cases. So today I'll be talking about cardiovascular health in rural settings, and this will include type 2 diabetes. Next slide. So our objectives for this morning: describe the epidemiology of cardiovascular risk factors in rural America, list and describe a minimum of 3 challenges to optimal cardiovascular health among rural residents, and list and describe a minimum of 3 strategies to engage rural residents in healthier nutrition and physical activity. Next slide. So I'm sure many of you are familiar with rural America. As Dr. Rao pointed out, Ohio has a very large rural population. In the United States, if you're thinking broadly, approximately 60 million people. And when that comes down to it, it's about 1 in 5 Americans live in rural America. So our population it's approaching 334 million, but 60 million of us are in rural regions. And I say us because I'm in Athens County, which is technically a rural region. When you think about the vast expanse of the United States, 97% of the US landmass is rural, but it only houses about 90% of the population. And if you think about the urban population, which the majority of you are living in, only 3% of America's landmass is urban, but it houses 81% of the population. Next slide. So when we're thinking about cardiovascular risk factors, this is things that we have covered throughout this series. We've discussed unhealthy diet, lack of physical activity, increased body size, and tobacco use. And these are well-known and established risk factors of cardiovascular disease. Research has shown that rural areas have higher BMIs, lower rates of physical activity, and higher rates of smoking. It's also important to note that rural areas, and this is a generalization, that some rural areas have less access to healthy and fresh food, some have higher costs with their food, and some rural areas also have fewer places to buy food. And because of these things in rural areas, there tends to be higher rates of food insecurity in some rural areas. And we know from other research that food insecurity is also associated with increased BMI, increased cardiovascular disease, and increased rates of type 2 diabetes. Next slide. So when thinking about this, all right, so we're talking about the increased risk factors. We've also shown increased rates in comorbidity. We think about in terms of access to healthcare and the care that these individuals are receiving. 20% of America's population is living in these rural regions, but they only employ 10% of practicing physicians. So the majority of providers in these rural regions are physician assistants and nurse practitioners, and thank goodness that we have those individuals practicing in these rural regions. It's also important to note that we have fewer physicians in these regions, but we also have a lot fewer specialists. And so the fewer specialists in terms of cardiovascular disease, we have fewer cardiologists, we have fewer endocrinologists, we have fewer dentists, we have fewer mental health professionals, which is incredibly important given the associations with type 2 diabetes and behavioral health issues, as well as cardiovascular disease and behavioral health issues. And we have fewer practicing pharmacists in rural regions. And if you look at certain maps in the state of Ohio, it's often common that you might have an entire county with one pharmacy. So what does this mean? What does this translate into? Well, for individuals who live in these rural, remote regions, they have less timely access to emergency medical services, hospitals, and clinics. So why is this important to know? Well, the research shows, and this is some of the work that was published in JAMA quite recently, looking at vital statistics data. And you see that if you're comparing, and this is age-adjusted mortality statistics, when you're looking at age-adjusted mortality statistics from cardiovascular disease, it is much higher in rural regions compared to urban regions. And even over the past decade, while the age-adjusted mortality for cardiovascular disease has decreased in most urban regions slightly, it has shown that there is an increase in rural regions. And a lot of that is preventable, but it has to do with timely access to emergency medical services, access to a hospital. Next slide. So we've already mentioned access to healthcare as a major barrier in this region. What are some of the other barriers? I have experience living in a rural region. I was born in a rural region in Iowa, a very, very remote rural region of a population of 500 people. And now I live in Athens County, which is considered a very rural region. Transportation difficulties. And if you haven't lived in a rural region, you may not be aware of all the transportation issues. There tends to be a lack of public transportation, or if there is public transportation, it's very limited. The roads in very rural areas tend to be unpaved. They're dirt roads, they're very narrow roads. And so if there's any type of extreme weather, even 1 inch of snow, a little bit of rain, these roads flood, or these roads become extremely dangerous with very little snow or even a little bit of ice. And so it becomes very treacherous for driving. And then a lot of individuals also don't have access to transportation. And if you don't have access to a car, or if you can't afford gas, it's very difficult to travel. We've already mentioned the access issues. And if we have fewer specialists, and we also have fewer providers in the region, you can also have a lack of quality care. We have fewer hospitals and emergency departments and clinics. And these are all the issues in terms that will also translate into poor outcomes. A lot of rural regions, individuals are living below the poverty level. So you have financial constraints. You have individuals who have less comprehensive insurance coverage. You have higher rates of food insecurity. There are housing issues and housing instability. And another really important issue, and this is something that has really been highlighted throughout the COVID-19 pandemic, is social isolation and the negative impact and the impact it can have on cardiovascular health as well as type 2 diabetes is that social isolation. Next slide. So let's get a sense of what does it look like in Ohio. So you can see here, so the darker blue, and it's very like maybe a cerulean blue, you can see the majority of Ohio here really is rural. And so again, I'm down at the bottom, right in Athens County, but you can see the majority of the state here is rural. You know, the light blue is a partially rural county, and then this light yellow, these are the urban counties here. The majority of Ohio here is a rural state. And then you can see that there's this big outline across the state, and that's focusing on the Appalachian counties. And you have about 1/3 of this state is technically Appalachian County. So I believe it's 32 out of the 88 counties are Appalachian. Next slide. So then just looking at this is some of the most recent data I was able to find. And this is coming from, let's see, the US Census Bureau Small Income and Poverty Estimates. So looking at this, you can just get a sense here. It's not giving specific rates, it's giving ranges here, but you're just seeing here the poverty rates. And so what do you see the pattern? Well, we just looked at the rural counties in Ohio, and now we're looking at the poverty rates. So you have poverty rates tend to be higher in those rural counties. So what does this mean? When you tend to have higher poverty rates, social determinants of health do not tend to occur in isolation. So individuals who are experiencing social determinants of health tend to have several social determinants of health. And so you can see here that this is important to note that these rural regions, individuals face a lot of barriers to healthcare. And these tend to also be grouped also in the Appalachian counties. And you can see here, according to this data, that Athens County, the county where Ohio University has the highest poverty rate in the state, and that poverty rate is 30.7%, so it's quite high. Next slide. So what can we do? Well, there is some promising research out there in terms of what we can do for cardiovascular risk factors, what we can do for type 2 diabetes. And here are 3 of these suggestions. And I also think we've been discussing a lot of the things over this series about things that we can implement that also work in rural regions. So text messaging interventions and text messaging to increase physical activity. When you look at cellular data, 94% of rural Americans have cell phones and 80% of them also have smartphones. So it's been a dramatic increase. And so there have been some interventions, and there are some ongoing right now that are using text messaging interventions to increase physical activity rates. And some of that data, that these randomized controlled trials are ongoing right now, with data to come forth in the next couple of years. We've discussed community health workers and the value of community health workers. Community health workers can provide chronic disease care and often lower costs, which is why they are such an important strategy. There has been research that's shown community health workers can reduce cardiovascular disease by influencing behavioral change. And this has been some research that is focused really on influencing diet behaviors. And then there have been some community health worker interventions that focus on stroke recovery. And they've shown that they can improve stroke recovery outcomes in rural regions. And then something that we've talked a lot about in the past year and a half with COVID is telehealth. And telehealth has been a very promising model for cardiovascular disease as well as stroke care. And some of the thing that's been researched is remote monitoring. So remote monitoring for health or for heart failure, for diabetes, hypertension, and stroke recovery has shown that it has improved patient outcomes. So all three of these are strategies that may work for rural residents. Next slide. So thank you so much, and I'm happy to take any questions.
Thank you, Liz. That was great. Really great, concise presentation. I've just been reading a little bit about this phenomenon, but how much do you think this phenomenon of endogeneity plays a role? In other words, if I'm motivated and better educated, more conscious of my health, I'm going to leave the rural area. And those who are left behind then are left to kind of struggle on their own. So that if you took those people and you put them in Cleveland or Columbus, it wouldn't necessarily mean they would do better. It's just this population of people that's especially vulnerable is concentrated in rural areas. How much do you think that that's playing a role, in addition to some of the environmental things you've mentioned?
That's an excellent point, Dr. Rao. So if you look at some of the population health trends, and I can focus it more on, rural Appalachia and Ohio, that's what I study here. And that is a major issue. So what it is showing is the younger population, the population that is able, to seek, degrees of higher education or to find employment in the larger urban areas, they are leaving. And so you have the people left behind, but what you also see in Appalachia is you have the older population left behind. So we have fewer younger individuals staying. So it's an older population that's aging. And so I think that's definitely a contributor. So you have not only the more vulnerable residents, but you have the unemployed, those who have lower educational achievement. It's exactly what you're talking about.
Thanks, everyone. So you'll have your usual post-clinic survey in your email box in just a few moments. Thanks for filling those out. The feedback is extremely helpful. And then, as I mentioned at the beginning, we do have a couple of slots open for additional case presentations if anyone is interested. So next week, I have one available space, and then our final week is open as well. So if you'd like to present another case, please feel free to email me. If not, we will definitely have cases, but just if anyone wants the opportunity for an additional case that you may have, please just let us know. And that's all we've got for today, but thanks everyone for joining, and we'll see you next week.
Thanks, everyone.